Hello and welcome to Dental Occupations 1 orientation. I'm Mrs. Hitt and I just want to go over a few things for the students to know what to expect for this virtual classroom year. The first thing we're going to go over is our supply list. You will need 1 container of Clorox wipes once we return face-to-face for instruction. 1 pack of colored pencils so that when we go over charting, we can use the different colors to go over the different procedures. 1 3-ring binder with notebook paper, dividers so that you can separate your tests, quizzes, worksheets, notes, case studies. 2 to 3 pair of scrub pants, solid colors only. If you would like to get the scrub tops, you can. If not, you'll wear a plain t-shirt with your jacket over it, and a pair of lace-up sneakers. Crocs and slip-ons are not allowed because they are against OSHA and safety. Your fee list, we're actually not going to go over at this time. We're still waiting instructions for all of our fees. The dress code for the virtual classrooms, you can wear scrubs or school attire that meets the dress code, no pajamas, no facial piercings, tongue rings, bars, plugs. Once we start back face-to-face, if you come in, I will ask you to remove that. And dental offices will not hire or keep you if you're wearing these types of things. It's unprofessional and it's against OSHA. Also, acrylic nails or gel nails are against OSHA. You need to make sure your nails are cut short. Hair pulled back, no pieces hanging down. And we will be discussing makeup and proper dress for interviewing later on in the school year. Any tattoos that you have that would be visible while working on a patient need to be covered. Here is your rubric for the classroom, clinic, and lab. The clinic and the lab right now only applies once we have the face-to-face instruction. Proper dress, including your nails, hair, jewelry, hygiene, clothing, proper materials. Your conduct needs to be professional and includes your body language, attitude, and then for the virtual classroom part, proper dress, nails, hair, jewelry, and clothing, proper materials. Your textbook you will have when we go face-to-face, but everything else will be on Canvas, including videos, worksheets, and if you have any questions, you can email me about that. Conduct, paying attention during the lecture, instructions, working on assignments given, no movies or music playing in the background. Attitude needs to be professional, no rolling your eyes. Body language needs to be appropriate. And remember to mute yourself once we start our classroom sessions. And if you do have any questions, you can add it to the chat section or you can email me.
Doug Moore, please call extension 1016. Thank you.
As far as lunch, we will discuss that once we are face-to-face in the building. And I'll also send out an email for parents letting you know what the lunch schedule is and what to expect. Cell phones, iPods are not allowed to be used during class time unless instructed to do so. There will be times when I say, grab your phone, take some pictures of the PowerPoint or whatever you're working on. When you come back face-to-face, you will be able to put your phones in your mailbox as soon as you walk in, and then at the end of the day, grab it on your way out to the buses. iPods, iPads are not permitted during, before, after school. If I see one of these things out, a parent will need to come to the main office to pick them up. Your headphones, earbud sticks, not permitted during class unless you're instructed to, or if you're virtual, and there's some background noise because you have siblings or a parent working from home, and you need that to be able to concentrate. But when we're in class face-to-face, you'll need to be able to hear my instruction in case of a fire drill or any other emergency that might come up. So if you have any questions about that, please feel free to email me, or if we do a virtual conference, we can discuss it. Field trips we will discuss once we return, and we will be able to know what our options will be. Virtual conferences. I would like to do some virtual conferences with parents one-on-one. If you would like to schedule a virtual conference, please email me so I can send you an invite. Make sure you include your student's name, the email that you prefer to have the invite sent to, the date of the conference, and what time frame that you're available. So if you're free from 8 until noon, then let me know that so that I can pinpoint an exact time that you and I can sit down and have that virtual conference. We are going to have an orientation part 2 once we do return to the schools. And so any paperwork or safety rules that I need to go over in person will be done at that time. And now I'm going to introduce you to the Dental 2 instructor that you'll have next year. And she would like to introduce herself and go over a few things about Dental 2, what to expect.
Hey. Hi, I am Regina Bartholomew. A lot of my students just call me Miss Bart because it's easier. And I know Dental 2 is a long way away. I just wanted to say a couple of things so that you would know what to expect and have a whole year in advance to think about it. The big thing in a normal world where we are able to go out to clinicals for sure is the driver's license. Students need to make sure they have their driver's license. So wherever your student is in the process, if they have their learners already, great. If not, definitely get on that so that when they do come to me, they will be ready to go. They have to be able to drive themselves to their dental office, stay there for the full day, drive themselves home. So that's one of the big things. Right now, again, like Mrs. Hitt said earlier, we're not sure what we are expecting now. So next year, I'm hoping things will be back to normal. If they are, great, we will continue with clinicals. They begin in January. But at this point, we are just kind of getting information as it comes to us. For Dental 2, I will have my own kind of mini orientation with your student in May. Whether it's going to be virtual or face-to-face, I hope we're back face-to-face. That way I can go over things to expect. A lot of the things Mrs. Hitt talked about, they're still going to need to wear scrubs in the second year. The jewelry, the hair being pulled back, all of those things will apply. Another thing that we have students do for coming into Dental 2 is to be X-ray certified, and that is something that your child will do through VCU. I will have more information about that to come, but that is basically allowing them to legally take X-rays from the neck up while they're at work during the second year of the program. I will be helping students once we are back face-to-face with information about clinicals if they are, for sure, I know where I want to go. I have one set in mind already. I've already talked to the hygienist at this dental office. Maybe it's a Virginia Family Dentistry, or maybe it's a different office. Great. If you have no clue where to start, that's my job. I will help you find a clinical site. So hopefully once things are back to normal and going into next year, we will be able to do that. The first semester we are in class, just like they will be this year. We will be in class that whole first semester, and like I said, in January, that's when we start clinicals, and your child will, after first period, get in their car, drive themselves to work, and then at the end of the day, they will be finished. Again, if you have any questions, you can email Mrs. Hitt. She can forward that to me. I can answer questions for you. I know a lot of parents are wondering about that hands-on experience, and we will get that. It may just be a little different this year, but hopefully next year everything can be smooth sailing for Dental 2 with the whole world going back to normal. Thank you so much.